Hey there, John Cummins again. This is predominantly for our female clientele, which is about 30% of the practice, and we do want to see more women because, I think with our model of deeper engagement and time to think about our patients carefully, we feel that we'd like to see 50% of our clients being female rather than just 30%. So this is about breast cancer screening. Don't forget, about 1 in 1,000 breast cancers do occur in men, generally with a gene mutation called the BRCA gene, but predominantly it's women. And so what I wanted to discuss is, look, when do you start screening with mammography? And it's an interesting question, and generally from 40 onwards, it's a discussion I would have with my female clients. And I'll give you probably more of my view as well as some peak body views. So when you look at international studies, international bodies like Canadian Task Force, US Preventive Task Force, Australian Colleges of GP, Cancer Council Australia, generally speaking, the recommendation from the age of 40 to 50 in an average risk woman, what I mean by that is a woman that doesn't have a strong family history of early breast cancer, that's breast cancer occurring in first degree relatives under the age of 50, 40, and a woman that does not have symptoms in her breast such as a pain or a lump or just feels different, then the general consensus is that there is no consensus. One of the groups recommends screening after the age of 47, and almost all of the others would say either no or let the client make up their own decision with informed consent, which I'll discuss in a minute. There's uniform agreement from the age of 50 to at least 74 that mammography screening is important and saves lives. And then after 74, it's a little bit debatable again. And I think that depends on how robust, how well the woman is. Because my usual way of thinking about this is when guidelines say to stop at a certain age, the presumption beyond that age is that someone's, average for that age and will probably pass away in 10 years from something anyway. So if you're going to save 10 years, there's not much point in screening. However, my experience is that the people that come here, they come here because they're healthy, they want to stay healthy, and they often get healthier. And so a woman that is maybe 74, 75 in our practice is often functioning like one at 60. And so I don't routinely stop and follow those guidelines. But so the question is, well, why wouldn't you do a mammography screening, say from 40 to 50 or even under 40? And again, this is my view. It's not necessarily the views of the other doctors in this practice, but there are some risks of that. And I can tell you, for example, and I'll just have to read some of this because there's a bit of data here, that somewhere between 9 and 11.5 thousand mammograms, you will need a biopsy. And the 9 is for the women in their 40s, and the 11.5 is sort of 60 to 69, for example, age 60 to 69. A lot of these will not show anything. And so, for example, you'll get benign disease in 2/3 of women biopsied between 40 and 49. And the number drops to about 50% of women post 60 because the biggest risk factor for any cancer and almost any disease is just getting older. So the pickup rate and the false negative rate is going to be much lower in your 60s because you're statistically more likely to have a cancer sitting there. So that means that, for 2/3 of women with a positive biopsy, you're putting a big needle in, which then, is uncomfortable or painful. It's more expensive because then you're paying generally out-of-pocket expenses for pathology and surgeons' fees and things. And also the anxiety is certainly the short-term anxiety, from that as well. And I've heard another figure a long time ago, I can't remember the reference, that you've got to biopsy about 10 women to find the one cancer, something like that. So you will get quite a bit of false negativity. There's also the evidence of overdiagnosis. So when you get two populations, one is cancer screening, one doesn't, and you track them over time, and you pick certain cancers in the screening and both can save lives, but you look at who's still going at the end of it. It's apparent to us that we do overdiagnose cancers. We pick cancers that if left alone wouldn't have bothered that individual person. I presume that's because they've got a robust immune system. And some of the data suggests that you will pick up probably 22% of cancers that if left alone wouldn't have bothered the person. And although we can, with more accuracy, define in prostate cancer who we should leave alone based on the histology and what we call the Gleason score, we're not there yet with breast cancers. So you're probably taking out too many lumps and cancers, but we don't, we can't select between them. The third thing is that, you can kill people due to the radiation from the regular mammograms. And it's estimated that about 16 per 100,000 women, you basically will die from the effects of the radiation. And one of my job descriptions as a doctor looking after you is to ensure that you don't get too much radiation in your lifetime, because I'm appropriately concerned, as we all are, that it's carcinogenic and ultimately we may be doing you more harm than good. So, as I said before, I would encourage any woman at 50, and I would probably encourage her to think about having an ultrasound at the same time, because mammography will miss cancers. The figure is nearly 1 in 8 breast cancers are missed during screening mammography, either because the radiologist wasn't good enough to pick it up, or it was just too small, or not well seen by the mammogram. So we know that the mammogram misses some cancers. If you do an ultrasound, you've probably got a high chance of picking it up. And let me just finish on dense breast tissue. It's a diagnosis of dense tissue that can only be made with a mammogram. It's not that you feel it. And we increasingly know that dense breasts hide cancers, and hence you need an ultrasound as well, because the mammogram can't see through the dense tissue enough, and they probably form more cancers as well. So I would encourage a woman, at least starting off, to do a mammogram and an ultrasound, and then you've got a good baseline such that if there are future changes, you've got two modalities to look at, the mammogram and the ultrasound. Hope that helps, and happy to field any questions as always.